Morning guys, so today I just wanted to make a quick video. Just going to quickly discuss ACLs. It's a really common injury. Well, it's not super common, but the trouble is it's really devastating when it does happen. So I've just been doing some extra reading on ACLs over the last few days. It's a bit of a passion of mine. I've had a lot of friends do ACLs and not return to sport, or if they have, they've returned to sport for a short term and done it again. Especially devastating in young kids. So the stats that I've seen are that in the professional ranks, around 90% or more of athletes who suffer an ACL injury will be playing again within 12 months. For amateur athletes and recreational athletes, the stats significantly reduced to less than 30% of people who do an ACL will actually return to their sport. So it's a devastating injury and it's largely preventable. Non-contact ACLs are extremely common when compared to contact ACLs. So if you have a high impact injury, unfortunately, there's not a lot you can do about it, like super heavy bodies colliding, legs getting caught underneath bodies, that sort of stuff, really hard to avoid. But the non-contact ACLs, where someone's simply, for instance in a game of touch footy, drifting across field, goes to pivot, step off one leg, and the ACL goes. So what I want to do is give you a quick anatomy lesson. It's going to be really basic and just let you understand. So this is especially for some of the coaches out there, coaches and parents. Kids aren't going to listen generally, but just so that we know why it's so important to do some of our strengthening exercises and how that helps prevent these massive injuries. So what I've got here is, excuse the dodgy drawing, I'm far from an artist, but you're going to get the gist of it. So we've got the thigh bone, the top of your leg, the bone that runs up through your thigh, okay? We've got your quadricep muscle, we've got your hamstring muscle group. So they're muscle groups, but I'm just going to refer to them as one muscle or muscle group. You've got your shin bone, and then you've got your fibula. So we're going to concentrate on your ACL, is this bad boy right here. So it attaches at the front of your tibia and goes through to the back of your femur. They actually don't run through each other. So you've got your PCL, your posterior cruciate ligament, which does the reverse. So they run side by side, not actually through each other. It's not actually an X like that. They're two separate ligaments. So your ACL, when your ACL ruptures, it generally comes from quite often what will happen is you can do a hard stop and your tibia is going to push forward and your femur is going to push back. So they're going in opposite directions, causing this bad boy to break. So what it's there to do is to stop this bad boy running forwards and to stop that going backwards in excess. So you can see it holds them together and fights those movements. Now what I'm seeing a lot of, I don't know why, I don't know where it's come from, but a lot of people in the rehab setting, and prehab can have a bigger effect on this, are working their quadriceps. So why on earth, I don't know, you would want to increase the strength of this muscle group at the expense of this muscle group. If you look at your quadricep runs down, goes into your patellar tendon, and the ligament attaches to the front of your tibia. So if you strengthen this, it's going to actually pull that forwards and put more pressure on that ACL, as opposed to strengthening the hamstring group. So we want to strengthen them both, but we don't want to strengthen one at the expense of the other. So what I see, especially in sport, is jumping, squatting, lunging, a lot of work on that quadricep muscle group, not as many hip thrusters, Nordics, glute band work to strengthen the hamstring group. So what's happening is if we can strengthen our hamstring group through here, that is going to help pull the tibia back. And when we get into those compromised positions where we're at a step, our knees at an angle, our leg locks out, if our hamstring group is stronger, that's going to help hold that muscle back in a dynamic setting and ultimately prevent or severely reduce the pressure going onto that ACL. So the hamstring group is the key. Quadriceps are great for performance. Hamstrings are great for performance. So don't be confused in thinking, oh, I'm just doing this for the sake of injury prevention. If you can increase your hamstrings and your glute activation, you're going to have a stronger, more powerful athlete, and you're going to have a more robust athlete that's less likely to be injured. So, like I said, a lot of people don't really know what's going on inside that knee capsule. This ACL ligament is there to stop anterior translation of the tibia, so forward movement of the tibia, and posterior translation of the femur. So we don't want these two bones to go in opposite directions, which is going to put a lot of pressure on this bad boy here. We want to keep them tight. Keeping them tight, this muscle group is the key. Get these bad boys strong. That's going to help pull it back. The ACL is actually there for static stability. So when we're walking, when we're doing slow movements in a high speed environment, it's just not thick enough and strong enough. Our big muscle groups should be doing that absorption or protection, and that's where we are really going to focus on hamstrings and glutes. So my athletes will know everyone gets a booty band at the start of the session. We do some glute activations, we do some hamstring activations, and we make sure that that muscle group's firing. And long term, let's severely drop the numbers of ACLs because it's preventable. It's 100% preventable. Like I said, you're going to get the odd one or two, but we don't need to see the numbers that we're seeing at the moment. So that's ACLs in a nutshell. And that's just a quick glimpse. I'm working on a full day athlete and coach presentation at the moment that will be coming out post-quarantine, post-COVID. And we're going to go into a little bit more depth, not just on things like this. This is about all the depth I think we need as junior athlete coaches and parents. But we're going to go into more high performance movements, why, just putting the why behind why we do everything and questioning some of the traditional forms of training that are a little bit outdated and the science and the evidence doesn't back them up. So yeah, it's today's ACL episode, and I'll keep you up to date with a few more. Thanks for watching.